Know that diabetes is not just one disease. It's a disease that can cause many other complications and following diseases due to its effect on the body, such as the immune system and circulation and nerves. So today let's talk about the skin, because as the largest organ in our body, if the internal part of our body is not doing well, obviously the outside part of our body is going to be affected. So first of all, let's recap. What is diabetes? Well, diabetes is when your body does not produce or does not produce enough insulin, or it is unable to use insulin effectively to maintain the blood sugar levels, resulting most often in an elevated blood sugar level. And about a third of diabetic patients experience skin conditions related to or influenced by diabetes. And why does diabetes actually cause skin complications? Well, due to the higher blood sugar, it can result in things like dehydration, dry skin, constant inflammation, which can result in a dull or overstimulated immune response, as well as nerve and blood vessel damage, which can reduce circulation and therefore it alters the skin structure, especially collagen. Without healthy collagen, the skin can become stiff or even brittle, meaning it breaks easily or it can be damaged easily, and collagen is absolutely necessary for proper wound healing. So let's go through some skin conditions that can result due to diabetes. Well, the first one is acanthosis nigricans. This is characterized by a darkened band of thickened velvety skin, especially in the folds near the groin, the back of the neck, or armpits. It can also be a sign of prediabetes, hormonal issue, or can be caused due to use of some medications such as birth control, corticosteroids, and niacin. It's not dangerous or contagious, but it is one of the outer skin conditions that could be triggered by diabetes. Another one is psoriasis. So this is actually characterized by red skin patches that may be itchy or scaly. And in more severe cases, it can actually develop into psoriatic arthritis, which includes severe joint pain. Another skin condition associated with diabetes is scleroderma diabeticorrhea. And it's a rare condition. It's a rare connective tissue disorder where symmetrical skin thickens, affecting the upper back, and in severe cases, it can actually restrict movement. And it generally affects people with excess weight. Having diabetes can also result in stiff joints and waxy skin. So this is characterized by tight, thick, waxy looking skin on hands and digits, so your fingers or your toes, due to circulatory problems. It might also have an orange peel appearance, so it might look kind of pockmarked or look really bumpy, and it may also cause joint stiffness to occur. Another thing that might occur from diabetes are the development of blisters or diabetic bullae. Some diabetic patients may develop irregularly shaped blister-like sores randomly across their feet and hands. These are often large and painless, and they may be isolated, just having one, or be in patches. If you have diabetes, they should not. Actually, if you don't have diabetes, don't break your blisters, because it can lead to infection. They usually do heal without scarring, but without scarring. But in rare cases, when complications arise, it can progress and result in amputation, as I may have mentioned in a previous video about diabetes and wound healing. So prevention of infection is really important. Another skin condition associated with diabetes is shin sport or diabetic dermopathy. So this is usually seen as circular reddish or light brown patches, usually on the shins or other bony parts of the body. About 40% of diabetic patients do develop diabetic dermopathy, and these patches are usually indented and scaly, and it's caused by nerve and blood vessel damage, in particular small blood vessels, so things like capillaries. Then we have diabetic ulcers, so things like these can be insignificant wounds that become open sores called diabetic ulcers. They can occur anywhere, most often on the feet. And they develop due to diabetes affecting the blood circulation and the nervous system. and these ulcers actually have a higher risk of tissue death, which can result in amputation. So I think we are down to the last few. So the next one is a bacterial infection. Because with diabetes, it affects your immune response, so you may be more prone to infections. So bacterial infections of the skin are usually as a result of Staphylococcus bacteria, and this bacteria is actually found naturally on our skin, but when your immune system is weakened, it actually allows this normally harmless bacteria on the outside of our skin. Remember, our skin's a protective layer. It can actually cause this bacteria to actually be able to sort of overpower our skin and cause an infection to develop. This infection is usually treated with, as you guessed, it's a bacteria, so antibiotics and effective blood sugar management to prevent it from becoming life-threatening. If sores do develop, usually the pus is released within a few days, but if they are painful or persistent and they don't drain away on their own, you may have to see a doctor to drain them physically for you. Common bacterial infections include boils, styes, nail infections, infection of the hair follicles, and carbuncles, which are actually firm, tender lumps of a collection of connected boils. So they're not pleasant, but if treated properly, they are not life-threatening. And finally, another skin complication can be fungal infections, which are characterized by red rashes bordered by scaly skin and sometimes small blisters. If you know anything about fungi, they require moisture to thrive, and as such, infections tend to occur in warm, wet folds of the skin. And common types include yeast infection, athlete's foot, ringworm, and they are treated with antifungal medication. So now that we know that with diabetes, it's not just high blood sugar and amputations, there are also skin infections and skin complications that can result from diabetes. So how do we, if you are diabetic, how do we actually prevent having or developing skin complications? First of all, is the most common advice is to maintain healthy blood sugar levels, and as you may or may not already know, it's through following a healthy diet, getting regular exercise, maintaining a good healthy weight, and following the doctor's prescribed treatment plan and medication. Obviously, if you develop different symptoms or complications, you would still want to go back to your doctor and discuss with them whether your current treatment plan is the best for you or if changes need to be made. There are many skincare tips that you can adopt into your routine to help prevent skin complications. These include special attention to personal care and hygiene, avoiding long or hot baths and showers, saunas and hot tubs, using bath products free of irritants and fragrance, using mild bath products, using moisturizers to prevent dry skin, avoiding feminine hygiene spray, avoid stretching or rubbing infection rashes and sores so you don't break them. You should treat cuts immediately and monitor their healing progress to make sure that they don't develop, to make sure that the healing process progresses as it should. Consult a dermatologist about persistent skin problems. And last one is something that's really important, is to wear well-fitting and comfortable shoes, as this can help improve circulation and prevent or lessen the impact of other conditions. Because if you wear shoes that do not fit well or compromise your blood circulation, it's needless to say that you are at a higher risk of developing complication in that area. So that is all for today. Thank you so much.